we will move on to our video, but first we do have a video planned here, but I want to turn your attention to the chat function. The team has posted a survey, which you can find a link to in the chat. And we kindly ask that you take a moment to complete the survey. The survey is important to the work that's being done, and we will be asking you to complete a survey at the end of today as well. So we would, the work would greatly benefit from the information that you would provide in that survey. So we kindly ask that you take a moment. And so I'll pause so you can all find it in the chat. You'll have to scroll a little bit to find it, but it is there. So please do take a moment and complete that survey. And as you all do that, I'll start queuing up the video. We are thrilled to now share with you a special video that brings together voices from across the globe: Canada, the United Kingdom, France, Spain, Italy, Germany, Japan, and Scotland. The video features representatives from international organizations dedicated to supporting individuals living with multiple chemical sensitivity. In it, they introduce their organizations, explain their founding stories and missions, and share their lived experiences working to advance the rights and inclusion of people with MCS. You'll learn important insights into trends from across different countries, common symptoms, social conditions, the persistent challenges individuals face in obtaining medical diagnoses, securing safe housing, and accessing appropriate care. Our speakers also offer some reflections about public awareness, the hurdles organizations encounter, and the policies and strategies needed to create a more future for people with MCS worldwide. It is a powerful reminder that while our contexts may differ, our goals and our resilience are shared. Let's play the video. Thank you.
Hello, my name is Rohini Perez, and I am speaking to you today from Canada on behalf of the Environmental Health Association of Canada and the Environmental Association of Quebec, along with our national partners and networks across the country.
Bonjour, mon nom est Michel Gaudet. Je suis le vice-président directeur exécutif de l'Association pour la santé environnementale du Canada et de l'Association pour la santé environnementale du Québec, avec nos partenaires nationaux et nos réseaux à travers le pays.
In Canada, multiple chemical sensitivity, or MCS, is a growing public health and human rights concern. Over 1 million people have been diagnosed nationwide, yet the condition remains largely overlooked in systems that are supposed to protect us. That is why our organizations have worked for over 2 decades to support individuals living with MCS, raise public awareness, and push for systemic change.
We have heard thousands of stories from people forced to leave their jobs, denied safe and accessible housing, or excluded from healthcare, simply because the air around them is not free of harmful volatile organic compounds, or VOCs, and toxic chemicals. But change is happening.
In 2007, the Canadian Human Rights Commission officially recognized MCS as a disability, calling for stronger enforcement of scent-free and lowest emission product policies. Since then, our work has expanded across the country. We have collaborated with all levels of government, universities, professionals, civil society groups, government agencies, and institutions. We have educated not only the public, but also decision makers and professionals about MCS as a legitimate disability. 8 years ago, the Government of Quebec began funding our work. In 2022, we were funded in part by the Government of Canada's partnership program, Disability Component, to implement our national project, Empowering Community and Removal of Barriers, or the ECRA project. The ECRA project has touched Canadians from coast to coast to coast, promoting the inclusion of MCS at the highest levels. It brought together disability, legal, environmental, medical, Indigenous, and other stakeholders. And we are deeply grateful to these partners for their dedication to building healthier, inclusive spaces, free of fragrances and harmful chemicals.
We are now scaling this work through phase 2 of the ECRA project, with continued focus on education, advocacy, and system-wide change. We also thank Accessibility Standards Canada for funding us to conduct groundbreaking research on inclusive air quality and its vital role in accessibility. We are equally grateful to the many volunteers who have given their time and passion to this cause.
Our core initiatives include the ECRA project, where we are advancing capacity, inclusion, and accessibility through rights-based education and advocacy. The Environmental Health Association of Canada, we have built national knowledge and action on MCS. The Ecoasis Housing Initiative, we work to create safe, accessible, affordable, fragrance-free housing for people with MCS. Our international advocacy, including our recent presentation to the United Nations Committee on the Rights of Persons with Disabilities, which helps spark global momentum for the recognition of MCS. Public awareness campaigns educating on safer products, healthy indoor air, and inclusive practices through webinars, tools, social media, and community events. We are proud to stand with our international allies in this resilience movement. Together, we are shaping a world where MCS is recognized, respected, and protected by law, here in Canada and around the world.
In our vision of justice, no one should have to choose between breathing safely and participating fully in society.
Clean air is a human right. Accessibility must include it. And our collective resilience is what will make this future possible.
Hi, I'm Nikki. I'm representing MCS-Aware, which is the UK registered charity for people with environmental illness. I founded the charity back in 2005 as a support group when I found myself affected really severely, and I had no idea what was going on. And at the time, luckily, I could occasionally get onto the computer, and so it was only by going on the internet that I found there were other people with the same disabling symptoms. And I figured out this was a thing called MCS, and I wasn't going completely mad. And there were strategies to cope with it and potentially improve my health. And so from there, I realised it would be really good to set up some kind of support group where we could actually get in touch with other people and support each other. And in 2011, I managed to persuade some people to become trustees, and we became a national registered charity, which is now how it's running. So since then, we've managed to put a lot of the information online so we can reach a wider audience. More people can get in touch. They can download help sheets directly off the website. So yeah, we have a bigger outreach, which is great. But MCS is not registered as a discrete physical illness in the UK. So we get a lot of people who have problems with housing, finding suitable housing. That's one of the biggest things. But we are still seeing a raise in amount of people that are emailing us for more information. And we tend to have a lot of very severely affected people who are sort of at their wits' end. and really struggling to cope to survive. We get a lot of those kind of sufferers who are desperate for support, and that's definitely increased. So it's really difficult to find sympathetic health practitioners who are familiar with the condition. We are lucky, I suppose, in some ways. We do have several environmental health centres. We also have a group of doctors who are the British Society of Environmental Medicine, which is a whole group of clinicians who've come together who study and support the treatment of chemical sensitivities. So that's really useful, but day to day, the onus is very much on the patient to find out what the issue might be and then to find a private practitioner who might be able to assist them on that healing journey. The thing that would be most helpful, particularly in the UK at the moment, and the thing that would be probably quickest to implement, is some fragrance-free policies for workplaces and for health providers. I really hope that we can band together and find some easier way to diagnose and to get support and recognition around the world, so that it is more of a uniform treatment experience for people, so they can, access the help that they need just to survive each day.
My name is Francesca Romano Orlando. I am a journalist and writer, and I'm also vice president of the organization AMICA, which stands for Association on Environmental and Chronic Toxic Injury. I would like to underline that AMICA in Italian means friend, because our organization wants to be friend of people. AMICA was formed in 2003, and we wanted to promote the awareness about the relationship between the environment and health, since the institution did not consider the environmental cause of illness, and especially did not recognize the rights, the special rights of people with environmental disability. We thought that an association was needed here in Italy. We receive calls from people who have chemical sensitivities, and unfortunately more and more young people have these problems, so they also have problems in going to schools because of the fragrance of the other children, of the teachers. Many people also have the problems in the environment at work, and many of them are forced to leave their job. So the number of people reporting chemical sensitivity is dramatically increasing. People have many big struggles with the housing, mainly because if you live in a condo, you are exposed to the fragrances of the other people around you. Here in Italy, we have the public health services. So it's a universal service. You have the right to be treated. But this does not apply to people with MCS, because if there are not safe environments, people with MCS prefer not to go to the hospitals. So if you want to have a diagnosis, if you want to ask for some kind of treatment, you have to go to a private doctor. In 2021, the Italian consensus on MCS was published, stating that MCS is not a psychological illness. I believe that a very simple step would be to recognize that this is an illness and that the patient need to be accepted with their limitations. So there is a lot of work to do. We as citizens need to work a lot to make political pressure on the institutions.
Hi, my name is Annabelle and I'm the secretary of Confesc. It was founded in 2004, and in 2018, MCS was officially integrated into our coalition. Spain has been working on recognizing MCS for a long time. Back in 2011, there was an important step when the Ministry of Health published the first official document about MCS. In 2018, 2014, MCS was finally added to Spain's official disease classification. It was given the code 9455.3, but it was still considered an unspecified allergy instead of a serious condition. Today, Confess unites over 65 associations and federations across our country. We focus on 4 key areas: political advocacy, scientific research and medical training, public awareness and human rights, education and visibility. MCS is a highly disabling condition that severely impacts patients' lives. It leads to systemic discrimination in healthcare, housing, employment, and legal protection. So Confess is working for improving healthcare services, which are currently inadequate or non-existent, achieving official disability recognition, allowing access to financial aid and social benefits, developing policies for safer housing, healthcare, and workplaces. We hope it's going to be hope and a good future for MCS patients, because it's a problem that affects every aspect of a person's life. They have to constantly avoid chemicals, which makes even basic activities difficult at every level. As I said, health issues, work, housing, medical care, social isolation, financial burden. So it's not just a health condition, it impacts every part of life, and patients often feel abandoned by the system. So we have to give them hope that they are going to be better in the future.
Bonjour à tous et à toutes. Tout d'abord, je tiens à remercier l'association SEC de nous avoir invités à cette visioconférence internationale sur la sensibilité chimique multiple, ou SCM en abrégé. Je me présente, je m'appelle Pascale Poupin, je suis présidente de l'association SOS MCS. L'association française SOS MCS a été créée en 2003. Il était important de créer une association comme la nôtre pour soutenir les personnes atteintes de sensibilité chimique multiple, pour plusieurs raisons. La SCM est une maladie grave et chronique qui affecte significativement la vie quotidienne des personnes atteintes. Les patients souffrant de SCM font face à une stigmatisation et un manque de reconnaissance important de la part du système de santé. Notre association peut aider à sensibiliser le public et les professionnels de santé à cette condition, souvent méconnue et incomprise. En plus de produire une infolette mensuelle, SOS MCS dispose d'un forum et d'une framaliste en ligne permettant à ses adhérents de se connecter avec d'autres et de recevoir du soutien et des conseils. Notre association joue donc un rôle crucial pour soutenir, informer et défendre les droits des personnes souffrant de cette maladie complexe et souvent incomprise. Nous avons également des parents qui nous contactent pour leur enfant qui est touché par la sensibilité chimique multiple. La SCM peut avoir des conséquences importantes sur la vie des jeunes atteints. Ils ont alors des difficultés à fréquenter l'école en raison de l'exposition aux produits chimiques présents dans les bâtiments. Ils sont isolés socialement car ils ne peuvent pas participer à certaines activités ou fréquenter certains lieux. Ils ont un risque accru de développer des problèmes psychologiques comme l'anxiété ou la dépression.
Le plus grand défi est de trouver un médecin au courant de la maladie, ou alors un médecin qui nous croit. Pour ma part, ne l'ayant pas trouvé, j'ai fait des recherches sur Internet et j'ai découvert l'association SOS MCS. Et c'est uniquement par le biais de l'association SOS MCS que j'ai pu obtenir un rendez-vous chez un professeur qui a posé son diagnostic.
Je suis chimico-sensible depuis 15 ans et demi et je suis médecin et j'ai pu continuer mon activité au prix d'aménagements importants. Pour ce qui est de la question des logements, s'il existe des logements adaptés aux chimico-sensibles, en France, non, pas du tout. Et c'est un énorme problème auquel nous sommes confrontés très régulièrement. Nous avons très souvent des appels de personnes qui ne trouvent plus à se loger, soit chez elles. C'est le plus facile parce que là, nous pouvons leur apporter éventuellement des conseils, toute une liste de choses à faire et à ne pas faire. Par contre, ce sont les personnes qui ne trouvent pas de location, qui sont surtout ayant perdu leur emploi, ayant perdu leur revenu, ne peuvent pas bénéficier d'habitat particulier et souvent se retrouvent à la rue. Nous n'avons pas beaucoup de solutions parce qu'en fait, nous ne pouvons pas proposer à ces personnes de les accueillir dans des lieux sains. Ça, c'est un petit peu ma partie. Je dois contacter les médecins, les services de santé et quelquefois les familles pour expliquer. Alors, bien sûr, tous les membres de l'association peuvent faire ça, mais en tant que médecin, éventuellement, on peut m'écouter un tout petit peu mieux, un tout petit peu. Je dirais d'abord améliorer la qualité de l'air extérieur et intérieur, faire diminuer toutes les pollutions possibles. Et il y en a tellement que ça serait déjà la première chose, parce que de toute façon, si on diminue les pollutions de l'air intérieur, par exemple, ça sera bénéfique pour tout le monde.
Donc, si on ne fait rien contre la pollution, nos maladies vont augmenter et il y en aura de plus en plus. Pour l'instant, nous n'avons pas accès aux hôpitaux, par exemple. Donc, c'est vrai que la situation actuellement est très, très compliquée pour les personnes sensibles aux produits chimiques.
Hello from Germany. First of all, I would like to thank you for inviting me to this MCS conference. I want to make it clear that I don't represent a large organization here in Germany. There are several self-help groups for people with environmental diseases in Germany, which are a great help for those affected. Unfortunately, we don't have an organization as large or as well-resourced as your association in Canada, which is known for its comprehensive activities, and the work you do is truly amazing and of great importance to all of us dealing with these issues, and I want to sincerely thank each and every one of you in the Canadian Association for your dedication and efforts. I founded the support group in our region in 2018 because face-to-face meetings can often be challenging for MCS patients due to the health situation and various environmental factors. We use social media tools for communication and to keep in contact. And this has allowed us to establish a nationwide network of individuals living with MCS. And this gap in support inspired me to take action, as I believe that no one should navigate the complexities of this serious illness alone. There's no centralized source of information here in Germany, and so it takes a long time to get the necessary knowledge about MCS and the necessary lifestyle changes. In Germany, MCS is categorized under code T78.4 in the ICD diagnosis coding system, recording as a physical illness caused by external factors. This code encompasses non-specific hypersensitivity, but can also overlap with various allergies. In our group, around 80% are women who are middle-aged or older, but there are also more and more younger people who have the disease and are losing their future perspectives because they cannot find a secure job or adequate treatment. In Facebook groups, people keep reporting that they have had the problem of suffering from MCS since birth. There might be a shift within the age groups in the future. Many patients get into financial difficulties through no fault of their own. On the one hand, they are often no longer able to work and suffer a loss of income as a result. On the other hand, they have high expenses for their health, as these environmental medical visits to the doctor, laboratory tests, and treatment methods are usually not covered by health insurance companies. And because many MCS sufferers are denied early retirement or the amount is very low, a large number of these patients unfortunately have financial problems and are dependent on social support. The mention of MCS was enough for an environmental medicine outpatient clinic to advise me to go to a mental health clinic. They said they had good experience there with spider phobia. There was no examination. I was not given any advice on what further examinations might be helpful. It was only with a doctor of clinical environmental medicine that I really received help.
First, thank you for this opportunity. Our organization, Life Environmental Network, is a self-help group for people with environmental sensitivity. It was formed in 2003. We are acting to enhance the recognition of our symptoms and share useful information for people. At that time, sick building syndrome was a huge issue in Japan. So there were many people who was troubled in chemical exposure. I decided to share my experience with other people. I received many questions about where is the hospital that treats MCS. I informed specialized hospital on MCS on my website. Some people need information of other hospitals, such as dentist, eye doctor, and surgeon. Allergists know about MCS well, but many other physicians are unfamiliar with it. I also got many calls and reports on school. Some children could not enter the school due to wax, building materials, and fragrance from other children's clothes. Her school nurse made a poster to inform children what is MCS and asked to do not use fabric softener with fragrance. For children with MCS, the Ministry of Education have been distributed low chemical textbooks such as copied textbook or dried one in school or home to reduce the ink and other chemicals. Japanese government has funded as many studies on MCS. Those studies suggested the need for regulation of chemicals, including fragrance, but the government does not reflect these results and suggestions in the policy. They put corporate interests before patients' human rights. People with MCS face difficulties in all aspects of life, such as education, healthcare, and employment. Unfortunately, there are misconceptions about MCS. I was to spread correct information and increase recognition of MCS. It is necessary to exchange information and cooperate with overseas MCS organizations.
I'm Janice Foster. I'm a chartered engineer in building services engineering and a researcher in environmental architecture. So my organisation is the Glasgow School of Art in a department called the Macintosh Environmental Architecture Research Unit. The unit was formed in 1993 and it was set up to undertake building performance evaluation assessments in thermally efficient housing in Glasgow. This understanding has led on to building fabric assessment and indoor environment quality assessment, which includes heating, ventilation, daylight systems, and how they impact occupant health and comfort. I had previous experience of people with MCS, as my younger sister, Davina, had MCS for about 15 years of her life. She died at 51 years old in 2000. So I I have a good understanding of all the challenges that she faced and that we faced as well as a family. Our work involves the investigation of indoor air quality to support health, but this work has so many overlaps with supporting people with MCS. We monitor total volatile organic compound concentrations and also take air samples to understand what the individual VOCs are in indoor air. The scientific community have known for decades that indoor air quality can be affected by building materials and other chemical emissions, but yet there's little progress here in Scotland to reducing the impact on people with MCS. It's a social justice issue since people with MCS are limited to where they can go. My support comes from having a sister with MCS and the realisation of how her world and her social circles were reduced to the point where participation in society was difficult for her. My sister, she had so many daily challenges that restricted her life in many ways. I could be here talking for hours about the restrictions and the challenges that she faced. But a few of them were access to the workplace, where she ended up losing her job. So her employer would no longer support her to be working from home. She was unable to go out for a meal, to celebrate events with family. She even had to find a chemist shop that didn't have perfume displays so that she could run in quickly to collect her prescriptions. She lost her social networks, and one thing that really grated on her was not being able to go to the theatre to watch her young daughter performing on stage. It should be that wearing fragrance products becomes socially unacceptable. Creating an enforced fragrance-free policy at universities would not only create a more inclusive environment for students and staff, but also could enhance the quality of learning for students. Establishing inclusive spaces for individuals with multiple chemical sensitivities is a crucial step for achieving social justice, gender equality, and addressing climate change, particularly as many of these products are derived from petrochemicals. It's my hope that MCS will gain greater recognition and understanding in the coming years. So increased awareness and advocacy are essential to drive change, promote the development of fragrance-free environments, and ensure those with MCS are supported in various settings. That includes workspaces, educational institutions, and all public places.
I live in Australia and have chemical sensitivities, also known as multiple chemical sensitivity or MCS. Today, I speak for myself and others living with this condition. I've also been given permission to share insights from ESRA, the Allergy and Environmental Sensitivity Support and Research Association of Australia. ESRA was established in 1994, born from the merger of two groups supporting people with environmental sensitivities. Despite their critical work, they receive no government support and operate solely through volunteers. Their members from across Australia seek advice on everything from safe housing, education and healthcare to legal rights and daily living, needs that often go unmet. People with MCS face immense barriers. These include limited recognition and understanding from the medical profession, limited legal protections, and ongoing misinformation that wrongly frames MCS as psychological in origin. Accessing healthcare is especially difficult. Very few doctors are trained or willing to diagnose MCS, and wait lists are long. Even with supportive evidence from emerging science, progress is slow and disheartening. Those with MCS need help navigating disability pensions, safe transport, housing, and education. Yet many can't access these basic rights. Human rights and discrimination cases involving MCS are increasing, but are emotionally and financially draining, especially without legal support. ESRA offers vital resources like its website, member magazine Sensitivity Matters, and individual support when possible, but it is severely limited by volunteer capacity and funding. Indoor air pollution remains a serious issue in Australia. While some fragrance-free products and dress codes exist, enforcement is rare and no national policies mandate chemical safety for MCS in public or medical spaces. MCS fact sheets from state health departments are often inadequate, and most environments remain inaccessible. Australia urgently needs consistent, fragrance-free policies, the use of least toxic cleaning and pest control methods, improved indoor air quality standards for chemicals and volatile organic compounds, and real enforcement of inclusive practices. Scientific knowledge about MCS exists, but it is too often dismissed. MCS is a complex condition, but it is a disability nonetheless. We deserve the same protections, adjustments, and access as anyone living with a disability.
In My Canada, we don't ask people to choose between breathing and fully participating in the workforce. We are an inclusive population and ensure everyone has full and appropriate access to work. For this to happen, clean air must be a cornerstone of accessibility.
Research shows that clean air allows people to achieve optimal health. In My Canada, I would like to see healthcare settings that are fragrance-free and healthy so that people with MCS can access medical care without being harmed by the air they breathe.
In My Canada, clean air is a basic right because the 1 in 5 Canadians with lung disease and the 100% of people with lungs need clean air to breathe, for accessibility, and to live without harm.
In My Canada, people with disabilities, including those with MCS, can live independently with dignity in homes, workplaces, and public spaces that are truly accessible, places that are fragrance-free, low emission, and inclusive by design.
In My Canada, I don't have to choose between my health and participating in life because clean air is everywhere, and my disability is understood, accommodated, and respected.
In My Canada, people with MCS can live their lives free from bias and discrimination in society, supported by unbiased research without spin, and practiced by doctors who are educated regarding the biological mechanisms of MCS.
In My Canada, it is inclusive of all people, including persons with disabilities, which of course includes persons with multiple chemical sensitivity, and that rights are respected and the rights that Canada committed to when it ratified the Convention on the Rights of Persons with Disabilities are fully realized.
In My Canada, no one is left to suffer in silence. As an Indigenous person living with MCS in the Yukon, I went years without a diagnosis, without safe housing, and without support, until I found the Environmental Health Association of Quebec. In a just Canada, clean air, medical care, and safe housing aren't privileges. They are basic human rights. Indigenous people with MCS deserve doctors who understand, homes they can breathe in, and support that reaches every nation, every territory, and every community. No one should be left behind, no matter where they live.
You have heard the voices from across Canada and around the world. Their message is clear. The time for action is now.
It is being reported from Canada and around the world that people living with multiple chemical sensitivity are being left behind, denied safe housing, excluded from healthcare, and forced out of public spaces due to the chemicals in the air they breathe. MCS is a disability. It is real, and the rights of those affected must be recognized and protected. As President and CEO of SOCIETE, I stand with every individual impacted by MCS. We call on governments at every level to act, to enshrine MCS in disability law, to develop and enforce fragrance-free and lowest emission standards, and to ensure safe access to housing, healthcare, and public services. These are not optional accommodations. They are human rights.
Canada is taking the first steps, and now we must lead. The UN Convention on the Rights of Persons with Disabilities compels us to include MCS in our frameworks for accessibility and inclusion.
As we build international partnerships, we do so with a deep commitment to justice, equity, and science. We will not stop until every space is safe, until every voice is heard, until every policy reflects the right to breathe freely. This is the future we are creating. In our Canada, we will lead with justice, compassion, and change. Thank you.
Thank you for that excellent video. It's really showed how many themes are shared and how there is so much good work that is taking place around the world. So it's a continued reminder for us to continue making these important connections and creating spaces for collaboration such as this one